That's Lady A this morning, 93.9 WLVB. It is 8:20. On this 10th day of May, we are in the midst of Mental Health Awareness Month, the month of May. And over the last many years, we have teamed up with the folks at Lamoille County Mental Health Services to bring you the many services that the folks at Lamoille County Mental Health bring to us, and of course putting an eye on it this month being Mental Health Awareness Month. And Sherry Marcelino is with us this morning. She is the Community Support Manager at Lamoille County Mental Health Services. So good morning, Sherry. Nice to have you with us this morning.
Good morning, Roland.
Let's see. So as Community Support Manager, maybe just briefly tell folks what you do as a manager at Lamoille County Mental Health Services.
Sure. So part of what I do is I am also the co-chair of the Lamoille Valley Housing and Homeless Coalition. So we partner with many community agencies to help people with various disabilities find housing and sustain housing as well. We also work with many management companies and landlords to build more infrastructure in the community to serve folks with lower incomes.
Well, we've certainly seen that evident in Morrisville, that's for sure, over the last many months. Evidence of a lot of housing. Actually, we did speak with you because it was we spoke with you I think a couple months ago during the we did a whole month series on housing too. So I think we
absolutely
we talked with you then. So now, as your in your job as community support manager at Lamoille County Mental Health Services, what would you say is the state of housing and with those who are looking for housing, especially those who are dealing with this mental health issue?
Well, Lamoille County has a less than 1% vacancy rate for affordable housing right now, which is one of the lowest in the state per county. About 50% of people that experience homelessness also report having a mental illness. So it's a pretty prominent issue. Homelessness in and of itself is a trauma, and many folks that are experiencing homelessness have a history of trauma. So many folks are hesitant to reach out for support. They're hesitant to engage. We work with folks who recently graduated from the DCF system. About 30% of our homeless population are folks between the ages of 18 and 24 that were in DCF custody at some point in their life. So they're very hesitant to engage with service providers. So, yeah, it's a kind of a tumultuous situation at times. But Lamoille County Mental Health was able to obtain a grant in July of 2020 to do outreach to folks that are literally homeless either on the streets or in hotels or in shelters, to just try to get their basic needs met and build that rapport with them without having to push services necessarily. Once they are engaged and they're ready to do housing search and move on to work on their barriers in housing, we offer what's called housing sponsorship. So Lamoille County Mental Health sort of vouches for the participants with landlords in lieu of maybe bad credit or no credit, poor references or no references, in order to get folks housed and to be able to work on their mental health treatment, whatever barriers they have to be able to sustain housing independently, increase their income, you name it. We sort of act as a safety net, both financially and support-wise, in order to keep them housed. Because really, the bottom line is how can you work on any of those things that I just mentioned when you're living on the street and don't have access to food, clothing, basic shelter, showers, and the answer is you can't.
Yeah, and there are more, and I'm sure you don't have the numbers in front of you, but I would have to guess that the number of homeless, the numbers have been going up, especially with the coronavirus. I mean, I think that probably had to have really accelerated the number that are out there.
Absolutely. I mean, yes, it did. I think it brought light to the folks that we already were serving, so meaning We actually had faces with the people we were guessing were out there that weren't accessing services at the time. But Lamoille has consistently in the past couple years had between, I would say, 70 to 80 adults that are literally homeless. And we, at one point, were serving about 34 children that were literally homeless. Those numbers right now are about 62 adults and about 21 children. So it does waver. And in the summertime, we do not have a homeless shelter. So a lot of folks go back out to tenting, living in the woods, living in their cars. So we don't hear from them. So it's really hard to guess at this time of the year how many people are actually in need of services and housing.
And of course, I know that they're working on, of course, they just had that fundraiser a little while ago, the Polder Splash, to help raise money for the Lamoille Community House in hopes of sometime down the road getting a permanent location that would be open year-round, I do believe. So that's hopefully something that's down the road. Now, so folks really shouldn't be, I know you're saying that folks are hesitant to contact you, but give me the information for folks who are out there that maybe haven't contacted you yet, and we urge them to do so, of course, to get them help. How do they go about doing that?
They can just call our agency at 802-888-5026. They can ask for myself, Sherry Marcelino. They can just let our folks at the front desk know they're in need of mental health support or housing services or what have you. We're just here to help, and we don't say no to anybody.
That's for sure. All right, Sherry Marcelino, Community Support Manager of Lamoille County Mental Health Services, doing great work as they all do.